Hello and welcome. Today we're diving into Guillain-Barré syndrome, or GBS, a rare but serious autoimmune disorder that attacks the peripheral nervous system. Join us as we explore its causes, symptoms, diagnosis, treatment, and more, offering a comprehensive overview of this complex condition. So, what causes Guillain-Barré syndrome? While the exact cause remains unknown, GBS is often triggered by a preceding infection. About 2/3 of people with GBS report having experienced a respiratory or gastrointestinal illness in the weeks before onset. Common culprits include Campylobacter jejuni, a bacterium often associated with food poisoning, as well as infections from cytomegalovirus, Epstein-Barr virus at the cause of mononucleosis, and even, in rare cases, the Zika virus. Rarely, GBS can occur after vaccinations or surgery, but the risk is extremely low. Now, let's unravel the pathophysiology of GBS. This is where things get a bit more technical. In GBS, the immune system mistakenly attacks the myelin sheath, the protective covering of the peripheral nerves. This myelin sheath is crucial for the efficient transmission of nerve signals. When damaged, nerve impulses are slowed or blocked entirely, leading to muscle weakness, sensory disturbances, and sometimes paralysis. The attack can also target the axon, the nerve fiber itself, potentially causing more severe and long-lasting nerve damage. This autoimmune response is what defines GBS. How common is GBS? Epidemiology tells it is a relatively rare disease. It affects about 1 to 2 people per 100,000 each year. GBS can affect people of all ages, genders, and ethnic backgrounds. The incidence of GBS tends to increase with age, and is slightly more common in males than females. What are the signs and symptoms to watch out for? The hallmark of GBS is progressive muscle weakness that usually starts in the legs and spreads to the upper body and arms. This weakness is often symmetrical, meaning it affects both sides of the body equally. Other common symptoms include tingling or numbness in the hands and feet, difficulty walking, severe pain which can be cramp-like, problems with bladder or bowel control, and difficulty with eye movements, facial movements, speaking, chewing, or swallowing. In severe cases, GBS can affect the muscles controlling breathing, requiring mechanical ventilation. Symptoms can develop rapidly over days or weeks, making prompt medical attention essential. How is GBS diagnosed? Diagnosis relies on a combination of clinical evaluation, physical examination, and specific diagnostic tests. A neurologist will assess the patient's symptoms and medical history. Two key tests are often used: a nerve conduction study and a lumbar puncture. Nerve conduction studies measure the speed and strength of electrical signals traveling along the nerves. In GBS, these signals are often slowed or blocked. A lumbar puncture, also known as a spinal tap, involves collecting a sample of cerebrospinal fluid, the fluid surrounding the brain and spinal cord. In GBS, the CF typically shows an elevated protein level without a corresponding increase in white blood cells. Magnetic resonance imaging (MRI) of the spinal cord may also be performed to rule out other conditions. While the term Guillain-Barré syndrome is most commonly used, it's important to know that there are variations. The most common type is acute inflammatory demyelinating polyradiculoneuropathy, or ADP, where the myelin sheath is the primary target. Other types include acute motor axonal neuropathy (AMN), which primarily affects motor nerves, and acute motor and sensory axonal neuropathy (MSNN), which affects both motor and sensory nerves. Miller-Fisher syndrome is a less common variant characterized by paralysis of eye muscles, unsteady gait, and absent reflexes. How is GBS treated and managed? There is no cure for GBS, but treatments can significantly reduce the severity and duration of the illness. The two main treatments are intravenous immunoglobulin (IVIG) and plasma exchange, also known as plasmapheresis. IVIG involves administering high doses of antibodies from healthy donors to help suppress the immune system's attack on the nerves. Plasma exchange removes the patient's plasma, which contains the harmful antibodies, and replaces it with fresh plasma or a plasma substitute. Supportive care is also crucial, especially for patients with breathing difficulties. This may involve mechanical ventilation, monitoring of heart rate and blood pressure, and physical therapy to prevent muscle atrophy and improve mobility. Pain management is also an important aspect of care. Since GBS is often triggered by infections, preventing those infections can indirectly reduce the risk of developing the syndrome. Practicing good hygiene, such as frequent hand washing, and getting vaccinated against preventable illnesses can help. However, it is important to remember that GBS is rare and that the benefits of vaccination generally far outweigh the very small risk of developing GBS. What is the prognosis for people with GBS? The majority of people with GBS recover, but recovery can be slow and may take months or even years. About 70–80% of individuals with GBS are able to walk independently within 6 months to a year. However, some people experience residual weakness, numbness, or fatigue. A small percentage of patients, around 5–10%, may have significant long-term disability. Relapses are rare but can occur. Research is ongoing to better understand the underlying mechanisms of GBS and to develop more effective treatments. Recent studies are exploring the use of targeted immunotherapies to selectively suppress the immune system's attack on the nerves, minimizing side effects. There is also research looking into biomarkers that could help predict the severity and course of the disease, allowing for more personalized treatment approaches. We hope this has helped you understand the complexities of Guillain-Barré syndrome. Thank you for watching.